Golden Med Tools proudly presents the Bedsore Blocker, the device that can help prevent skin injury from pressure ulcer. Welcome to the Bedsore Blocker training program. The training will take approximately 15 minutes to show how to use the Bedsore Blocker on the patient. We will see how it can help prevent skin injury on the back part of the patient's body. Before we start to show how the Bedsore Blocker will be used on the hospital bed with the patient is, first, to become familiar with the Bedsore Blocker. The Bedsore Blocker is the polymer lightweight portable device that weighs about 9 pounds or 4 kilograms that is contained with a piston, also known as an actuator, that sits between the base unit and the back part of the backboard unit. The backboard unit has multiple round holes and a large oblong hole. The oblong hole is used for handling for placing a hand, grip it, and lift it for maneuverability. These multiple round holes' objective is to allow atmospheric air to flow through the holes for recirculation that will help to keep the skin cool and dry. The Bedsore Blocker has a lever located at the top of the backboard that allows to change from a range of ankle position from 45 degrees to 75 degrees. The purpose of the lever is to provide a bedridden patient in a longitudinal lateral position and in a comfortable angle while the patient is leaned on the Bedsore Blocker. The piston is latched between hinges located on the base unit and the top rear of the backboard. The top hinge has a pin that is inserted through a hole that holds the piston to the top hinge. The pin has a tiny round ball that allows to secure the latch. Also, the pin is connected to a cable to prevent losing the pin. To remove the pin from the hinge's hole, simply pull out with little force horizontally from the hinge. Now, the piston is disconnected and can place the piston flat on the base unit with the lever lying flat on the base unit. The next step is looking at the bottom of the backboard unit that contains 2 removable hinges. The first method is to remove the baseboard. Simply lift the left hook up of the hinge and pull horizontally outward, then push the hook down. Now, slide the backboard unit horizontally to the right and lift it up. The second method, which is best recommended, is to bring both hands to the 2 hooks. Place your thumbs on hooks and pull outward, and lift the backboard up. To assemble, bring the backboard to the base unit hinges. Pull both hooks outward together, align them to female hinges, and let go of the hooks until you can hear a click. The third method is to put your right thumb on the right hook and lift up, pull outward, and let go. Then slide the backboard horizontally to the left and lift it up. The purpose of removing the backboard is where there may be an occasional incident that the patient discharges human waste, can dirty either the base unit or the backboard unit, or both. If it does happen, it can be easily cleaned by washing soap and water and dry it with a soft cloth. These hinges are stainless steel and aluminum that are water resistant. The base unit has the rubber mat underneath the base unit. The purpose is to prevent from sliding on the hospital bed. Now, let's assemble the remaining Bedsore Blocker together. The next step is to bring the piston to the top rear of the backboard unit. Now, align lever to a vertical position like an antenna. Make sure the lever hole is aligned with the hinge's hole. Now, take the pin and insert it horizontally until you can feel it is secured. The Bedsore Blocker is now assembled and ready for use. Finally, let's play with the adjustable position. Place the bedsore blocker on the bed. Then place your left or right hand on the lever. Squeeze the lever towards you and push it down firmly until you can feel it is moving downward, and release your hand. To change the angle of position, simply by placing your left or right hand and squeeze it towards you, you will now feel it is raising towards you. Play around with squeezing the lever and push down, and/or raise, then release the lever. Now you should feel comfortable using the bedsore blocker and ready for use. Let's see how we can use the bedsore blocker on the patient. The first step is to ensure the patient is lying flat on the bed in a supine position. If not, please lower headrest and feet rest until the bed is completely flat. Secondly, ensure the patient is resting in a supine position right in the middle of the hospital bed. Thirdly, make sure the bed rail on both sides of the hospital bed is in up position and secured. We will now begin to turn the patient in a longitudinal lateral position, but before you do that, make sure the bedsore blocker is sitting on the bed closest to the patient's left foot. And the front of the bedsore blocker is facing toward the feet. The nurse is standing on the right side of the hospital bed, right at midpoint length of the patient's body. The nurse is now ensuring the patient is properly resting in the middle of the hospital bed. The nurse is now turning the patient toward the left in a longitudinal lateral position. While holding with one hand, the nurse brings the bedsore blocker closest to the midriff part of the body and place it on the hospital bed. Now let go of the patient. The bedsore blocker is now holding the patient. Ask the patient if he or she would like higher or lower angle of position. By doing so, squeeze the lever, and while squeezing, push the bedsore blocker down to its lowest level or patient comfortable position and release the hand. If it is too low, you can raise the angle of position by squeezing the lever toward the backboard, and it will commence raise the angle of position. Now, from 2 to 3 hours later, the nurse will now turn the patient to the other side of the bed. By doing so, the nurse will place the right hand on the patient's left shoulder or deltoid. Now the left hand will grab the bedsore blocker from the handle and lift it and place next to the patient's feet. Now, the nurse can put the patient's body on the bed in a supine position. The nurse can now release the right hand off the shoulder or deltoid. The nurse will now walk around the bed to the left side of the hospital bed. The nurse will now turn the patient to the right in a longitudinal lateral position. The nurse will hold the patient with their left hand and bring the Bedsore blocker with their right hand to the center of the body. The nurse will ensure the Bedsore blocker is closest to the body and place it on the hospital bed. Now, lean the patient towards the Bedsore blocker and gently let go of the patient. If necessary, ask the patient if he or she is comfortable at this position. If not, play with the lever to down or up position until the patient accepts the comfortable level. Now, we have completed the turning technique of using the Bedsore blocker. The patient over will be resting comfortably and without having any pressure on the patient's back of body. The air will flow into skin to keep it cool and dry. If the patient has an existing bedsore, the damaged skin may heal slowly over time, and the capillaries may heal by itself over time as well. In this section, we will show you on how to clean the Bedsore blocker. First, gather all the necessary items, such as baby wipes, cloth, or towel, and soap. You can clean the Bedsore blocker in the patient's bathroom or on an empty large container. Now, for routine cleaning maintenance, you can use baby wipes to quickly and easily clean the backboard. If the Bedsore blocker requires a deep cleaning, you can easily wash the backboard in the bathroom sink or in the tub or a large container. Now, get a clean and dry cloth or towel and begin to dry the backboard until there is no moisture. The next step is to assemble the Bedsore blocker. This concludes the basic training of how to use the Bedsore blocker. Thank you and enjoy the product!